Hi, and welcome to State of Mind. I'm Dr. Shyam Bhat, psychiatrist and physician, and this is the podcast about everything to do with the mind. I want to share with you two common scenarios and consider how differently they might end. In the first scenario, a lady starts feeling a bit low, she feels sad, she feels withdrawn, she doesn't feel as energetic as her usual self. Her sense of self, her self-esteem is not as good. And she also feels stressed and anxious. And so people around her notice and she tells them that she's not feeling good. She cries as she's talking about how much emotional distress she is in. And so her friends suggest to her that she goes and sees a psychiatrist. And so she does. And when she goes to the psychiatrist and narrates her symptoms and tells the psychiatrist how she's feeling, the psychiatrist asks her several questions and determines that she is feeling sad, that her appetite and her sleep has been affected, that she's not feeling good. And so the psychiatrist diagnoses her with major depressive disorder. She is treated with medicines and with therapy, and she recovers, and she is happy, and she's back to her full normal self. Scenario 2, a man who's going through stress starts feeling a little bit irritated. He doesn't really know that there's something different with him, but people around him start noticing that he's much angrier than usual. You can't say the slightest thing to him before he snaps and he starts shouting. He starts drinking more than usual, and he started to drink almost every night now. He stopped, meeting his friends. He's withdrawn from his family. And when they ask him how he's doing, he just tells them that he's okay, but he has some things on his mind that he needs to deal with. They notice that he's getting more angry, he's getting more irritable, he's drinking more, he's not sleeping well, but he says, I'm doing all right. His body starts paining, he's got headaches, he's got body pains, he feels tired, he feels almost like there's a pressure cooker, like he's a pressure cooker waiting to explode, and yet when he's asked, he says, I'm doing all right, I'm managing. And this goes on, and he alienates people around him because of his drinking and his anger, and now he's even more alone than he was previously. And one day he feels so alone, so tired, so much in pain, and when he's drunk, he tries to take his own life. Unfortunately, there is a lack of understanding of male depression. And we heard the news recently of a young man, a TV star who committed suicide, and that reminds us of this issue of male depression. Of course, depression is a gender non-specific issue in that it affects people of both genders, and it's a human issue, but we have to understand how it affects men and women differently if we are going to prevent and treat this issue. Because if you look at the textbooks and the statistics, you'll see a very strange thing. You'll see that it says that women are twice as likely to suffer from depression as men. So if the prevalence of depression in men is about 5 to 7%, the prevalence of depression in women is about 10 to 15%. But then you see the startling statistic that men are twice as likely to die from suicide compared to women. So in our country alone, annually, about 80,000 women commit suicide. And if that's not an alarming and tragic number, consider that 150,000 men also commit suicide. So we lose about 230,000 Indians every year to suicide, about 150,000 men, about 80,000 women. So there's a disconnect there between the statistic of women having are twice as likely to suffer from depression, but half as likely to die from suicide. Now, one of the reasons, as I explained in the two narratives, is that we often don't recognize that depression in men presents differently. And the reason that statistics say that women are half as likely to suffer from depression is because the criteria for depression, as written in psychiatry textbooks, may not apply to men. So the criteria for depression, for example, are feeling low, having lowered self-esteem, having more guilt and feeling tense inside. But one of the implicit things in the criteria is that the person must be able to self-report. The person must be able to say that they are feeling a little low, that they're not feeling as good. Now, what you see with men is that when they suffer from depression, they may not feel sad. They may not know that their mood is different. In fact, they're more likely to do one of three things, or all three of these things: aggression, numbing, and escape. So a female who's depressed is more likely to feel sad, to talk about it, to cry, to communicate. But the man who's suffering from depression is more likely to be aggressive, to numb the emotions through substance abuse, through diversion, etc., or to run away from the issue, to isolate from the family, to isolate from work, and so on. So typically a man who is depressed is often doing things that makes them perhaps not appear depressed, but appear like they're behaving badly. The man who's drinking to numb the pain, the man who's using pornography, that's also very common, to dull the pain. A man who's getting into impulsive actions, more road rage, doing things impulsively to cope with the pain that they're barely aware of. And why is this happening? Well, maybe there's some biological differences, but there are certainly some social causes for this. So men have been raised in the masculine ideal, and for many societies, the ideal of a man is men don't cry, or as we say in India, mard ko dard nahi hota hai. And so the boy is told when he's growing up that, listen, if you cry, you're going to be a sissy, you're going to be, do you want to act like a girl? Man up. And so the ideal, the role model for many boys who then become men is that there's certain emotions that are not part of the male identity. We cannot feel that. To feel that is to be less of a man. And there are some interesting studies where they found that men who are higher on this masculinity scale, on this traditional masculinity scale, are more likely to suffer from what we call externalizing symptoms. That is, when they are depressed, they're more likely to do things behaviorally. Drinking, aggression, fighting, getting irritable. Whereas women and men who are lower on the masculinity scale are more likely to have internalized symptoms, like feeling low, feeling sad, and so on. So it's clear that depression affects men differently, is often missed, and is often a dangerous condition that can lead to fatal consequences. So if you or anyone in your family is suffering from any of these symptoms, feeling angrier than usual, feeling numb, using alcohol or any other substances to deal with your feelings, then I urge you to not be alone, to talk to people who are close to you, and to seek professional help. Because another issue with traditional masculinity is the idea that to seek professional help makes you weak, is a sign of not being a man. But that's not true. Being strong also means seeking help when you need it. They are not mutually exclusive. So I truly hope that anyone who's listening and who's suffering will talk to somebody, will seek help, and that if somebody in your life is suffering, that you reach out and offer them support instead of turning away. Thanks for watching and listening to this episode of State of Mind. You can like the video, share, and subscribe to this channel. I'm Dr. Shyam Bhat, and I'll be back soon with the next episode.